Hello, and welcome back to Civic Concord, a podcast where we share information, highlight important topics, and hear directly from people involved in town government. While this episode might come out in early June, at the time of recording, it is still May, and it is Mental Health Awareness Month. For this conversation, I would like to welcome Public Health Director Melanie Dineen and Public Health Nurse Moira Carter. Welcome, Melanie, Moira.
Thanks, Megan. Thank you for having us.
Thanks, Megan. We're excited to talk about this today.
Great. So can you tell us why Mental Health Awareness Month is significant and what are its primary goals?
The most important thing about May and Mental Health Month is to get people thinking and talking about mental health in a normalized way as part of their normal everyday conversation.
Right. We really want to spread awareness of the importance of mental health, the impact, and normalize is the perfect word for it. Normalize seeking treatment, care, support in whatever way works for you.
And so how does the Concord Health Division participate in or promote activities during this month?
Well, we've done a couple of things this year, kind of fun. First, we partnered with Emerson Hospital last fall, and we planted at the Beatty Center some yellow tulips that came up. Also, we planted at the Council on Aging, but those did not work out. We ended up with some yellow marigolds to kind of share awareness about mental health, talk about stigma, and get people to understand and connect with the resources that they might need. Moira also gave a talk about mental health at the COA.
Right. The Yellow Tulip Project was really important to us. Emerson had been doing it for just a few years now, and we joined them. Originally a project that was meant for youth and created by youth, but very much applicable to the whole population. And so Emerson has taken that to spread awareness. And this year, Concord joined in on that project, which was really fun to see the tulips bloom and exciting to spread the awareness piece. And while the tulips have come and gone, the resources are still there. We have some signage that people can connect with resources still up at Beatty and at COA.
Yeah. It was really fun to work with Jenny, the director at the Beatty Center, to get to know her. We had a lot of fun. One more important thing we did on May 24th is we had at the library a mental health first aid training that we offered. The opioid settlement monies are been used to hire a clinician, substance use prevention coordinator, and she's a trained mental health first aid trainer, and she gave that at the library. We had 9 participants, great reviews with requests that we do that again. So we felt that was a great start to kind of talking in the community and helping people support their loved ones that might be in need of mental health support.
So I know you in the health division care a lot about data and you're doing a lot of research to try to understand the need here. Can you talk about some of the prevalent mental health challenges faced by residents in Concord and any of the data that you've used to kind of understand that?
Yes, we worked pretty hard last summer and last fall on a public health needs assessment. We felt that we needed to collect some new information from the community, and we worked on and disseminated a needs assessment. And we had about over 500 response from Concord residents.
We did over 500 responses, and the community health needs assessments too are really foundational for public health in terms of getting directly from residents their input on health needs and health priorities in the community.
And some key findings that came out of that for us, when everybody was asked, how do you feel about your mental health? The majority said, we feel good, our mental health is great. But when we asked the question a different way, we said, how do you feel about yourself or a loved one in your family, in your household? Over 60% said mental health was a moderate or high concern. And also a separate question, over 40% said they had concerns about themselves or a family member about isolation and loneliness. We really took that to heart and have been thinking about ways that we can address those.
Right. And while we can't fully generalize the survey results to the entire community, the 500 respondents and their input is still considerable. And so with other surveys too, like Emerson's work and their strategic improvement plan. All of those things do line up in terms of mental health needs being significant in the community.
And so if people need resources or they need care, of course, they can reach out to their healthcare provider. But are there other resources in town that are available to help folks if they're struggling?
Yes. So in honor of Mental Health Awareness Month, we've really tried to have a big focus on this. The Concord Health Division in general, division does a whole lot of different things, but one of the things that we really have strived for is to promote the importance of mental health and to better connect and promote available resources within the community. And so one of the things that we did put out this month is a flyer from the Concord Behavioral Health Collaborative. And we'll probably touch upon that group in a bit, but the flyer itself is meant to really make it clear that folks are not alone. The prevalence of mental health issues is significant, and there are resources available. So we highlighted the Massachusetts Behavioral Health Helpline that can be reached via call or text. The number for that is 833-773-2554. And that is also available online at masshelpline.com, available all the time, 24/7, even on holidays, free, confidential, and a really good starting point for anyone who's seeking any sort of behavioral, mental health, substance use needs.
That's great. That sounds like a great resource. What about if someone wants to, seek a counselor? Where would they start? Do we have any resources to talk about there?
We have a couple. First, we want to highlight that we now have in Concord a behavioral community clinician that is specific for Concord residents and students at Concord Carlisle High School, that if they need to, as a resource to get help, they can contact that resource through Elliot. The information is also on our webpage. We encourage everyone also to look at Emerson Hospital has considerable resources. They put a lot of time and effort into highlighting, and we've put that on our webpage to find. Sometimes at the Emerson Hospital, it's hard to find it, but if you go to the Health Division webpage on the town of Concord, under Behavioral Health, there'll be a link to the resources for a lot of different opportunities through Emerson Hospital to find there. Some of the good thing about our Concord community clinician, some providers take certain specific insurances and some don't, and this community clinician is need blind, so they will take insurance if you have it, but you don't have to have the appropriate insurance if you're in crisis and you need immediate need, and a clinician might be available in a couple of months, but you need something now. We're striving to make sure that there's spaces available that somebody could be seen in the short term.
That's great. That's one of the reasons I wanted to have you both in here, because this is kind of a new resource for Concord. And I know that it's been something that many people in town have been talking about the need. Other towns have kind of worked on this type of model. And now we have this counselor in place, and there are some, available openings for people that need it in crisis moments. So just trying to raise awareness about that real benefit here.
Yeah, it's kind of been a great collaboration and need. In January 2023, I worked to establish a behavioral health collaborative. It's a model that a lot of towns have. The town manager's office had charged the health division with spending the opioid settlement monies. In order to do that with informed voices, we worked to get the collaborative up and running with people with lived and living experience with substance use, as well as anybody working in the community that has anything to do with mental health or substance use. So we have a strong collaborative. And one of the first things that came out of that was the need for this resource. So I feel that was the group really working together and advocating to the town manager, and for us to be able to support that and have this resource available is a great win for the whole team.
Great. Yeah, I was going to ask you about, how the health division collaborates with local organizations or the schools. And it sounds like they've also been involved, and it's been different.
We have representatives from the school department, both the superintendent and the assistant superintendent, as well as we work with the nursing staff there quite a bit. So we have a lot of different work interaction with the school department.
Great. I think you talked a little bit about misconceptions about mental health and how to address them. But do you have anything else to share about, the importance of open conversation and reducing the stigma, encouraging individuals to seek help?
Definitely. So our thought being that mental health treatment should be as normal as going to the doctor for an earache, something that we do to take care of our general well-being. And there are definitely lingering misconceptions that those in need of mental health support are not strong, and that is just simply untrue. We are all wired a little differently, and some folks need support at different times in their lives, and others need more lifelong care and support. And needing mental health support is in no way a weakness, just like going to the doctor for routine medical care. Mental health conditions in general include a whole many things, but anxiety, depression, and eating disorders, obsessive compulsive disorder known as OCD, post-traumatic stress disorder known as PTSD, among many others. So really wanting to normalize care.
And so looking ahead, what are your hopes for the future of mental health services in Concord?
I think the dream is really that everyone get mental health treatment and support that they need, and to be a strong community that supports individuals getting that help, and that we talk about mental health and reduce that silence and connect with one another and remind individuals in the community that there is help, there is hope, and support those connections to resources and care, and that we don't always know what others may be going through or struggling with, and the importance of being kind.
Great. Is there anything else you'd like to add on this topic?
I don't specifically. I think Moira said it quite well.
Yeah.
I appreciate that.
Well, we've really been excited to talk about mental health today. It is something that's really at top of mind, I think, in the community, but certainly in the Concord Health Division as well.
And I think we are moving forward from our needs assessment. We're going to be trying to put together a health improvement plan. So some strategies to address isolation and loneliness. And we have some great partners. We've been working with the Council on Aging, with the Recreation Department, with the library, because they are seeing the same needs in our community and how we can work together to fulfill some of the needs of the people. That is helpful when people give us feedback. We really like to hear from folks, like what would help, what their needs are. And we don't want people to suffer alone. So we want them to come out, try something new, see something that interests you. There's a lot of opportunities there. And if it isn't, they should let us know what they'd like.
Great. Well, thank you both so much for joining us today. We appreciate it. And see you next time.
Bye.